when you look at the role of depression in heart disease, there is a definite correlation in that people who have heart disease often are depressed. Again, is it the chicken and egg combination? Is it because of their poor circulation or because of their chronic disease? And until very recently, this was something that was not necessarily recognized or screened for by cardiologists. I've seen some data recently where that when someone has, say, a heart bypass surgery, that they will often start screening them for depression, that maybe it's the realization that they have a chronic illness and going through that surgery, that quite often in that post-surgery period that people end up being depressed. And as you can tell, it's tough distinguishing the symptoms such as low energy and fatigue and low physical activity. Is this really something that's related to their heart disease, or is it related to their depression? Depression can actually make the graded exercise test, so the ECG component, less sensitive. So you're going to miss out on people who actually have heart disease, type 2 error, when they actually do have heart disease. And then, they do find that people who are depressed, once again, chicken and egg, they tend to develop more cardiovascular disease. Anxiety and heart disease. People who have panic disorders, phobias, PTSD, obsessive compulsive disorder, OCD, generalized anxiety disorder, so your fight or flight. So that is also, not surprisingly, going to lead to cardiovascular disease because these people are in the constant fight or flight mode. So it's going to manifest itself in higher blood pressure and higher heart rates. And as we know, we talked on the previous slide about the role of blood pressure in athero and arteriosclerosis. So people who have anxiety do need to be monitored. Social support. People who do not have a good social network of, people who are close to them in dealing with a chronic illness are going to have a poor prognosis than people who have a better social network. So increased risk of dying after they've had a heart attack. And then looking at, the people who are there around you. Who is your structural support, your marital status, your friends, your participation, and versus saying having functional support versus the use of an aid or some other type of therapist. So you have to remember, especially for those of you that want to go on into some sort of therapy related career, that you are part of that functional support. And not only are you the person who's going to physically assist them with their rehab, you're the person. Sometimes people who have a lot of chronic illnesses, they may be older, they may be isolated, you might be their social support. There might not be much else social support. So you have to remember that. And as people develop more chronic illnesses and they spend more time in doctors' offices and with healthcare professionals, they tend to see more of that functional support personnel and maybe less of their family and friends, and that their entire social life consists of going to, doctor's appointments and other types of therapy, and they're not spending time in their usual activity. So you might be that source of support for other people. Looking at diabetes. We've just finished a section on that. As you know, stress and depression and anxiety, and then stress stimulates blood glucose. The high blood glucose also causes injury to the endothelium. So people who have diabetes, and in the Diabetes Prevention Project, they find that when people had behavioral components as part of that intervention, that they did much better. And the results of the Diabetes Prevention Project. Cognitive behavioral therapy, so targeted problem solving, has been shown to be very effective in people who have chronic diseases. And that's something I wish as exercise scientists that we really had more training in, because we really could use a lot about relapse prevention, and helping clients solve some of their problems at home.